Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from my new podcast studio in my house, actually, not from an underground bunker. It's just going to be me today, and I have an exciting topic to talk about, which some of you are going to find really, really surprising, possibly. But I'm going to talk about MTV VJ. Kennedy. And yeah, she changed my career. She really honestly did. Well, you got to say, well, how did Kennedy change a pharmacist's career, right? So I'll get into that backstory. And first of all, for people that don't know, what is MTV or what is a VJ? And I had to kind of rethink those terms because I haven't watched MTV forever, and I haven't used the term VJ forever. So, but back in the 80s and 90s, MTV was really big. I'm sure it's still around, but I don't think they play videos anymore. And they would play videos a lot. And that's how we saw a lot of our favorite artists and listened to their favorite music. And and so back in the 90s, Kennedy was a VJ on MTV, and here she is over the years. Now she's a host on Fox News, I believe, Fox Nation or something like that. And she interviews people on political subjects from all over the world. But in college, I had a crush on Kennedy. And you're like, well, where is this going with a crush on Kennedy and how did it change your career? Well, I had a crush on Kennedy, so I would watch her often as I could. And I didn't know a lot about her politics because she didn't talk about it when she was on MTV. And but then one day I'm following her to an interview, and she's being interviewed by John Stossel. And John Stossel was on NBC News in the 80s, and then he went over to Fox News in the 90s, I believe. But he identified himself with Kennedy, and he said it in together. It's like, well, us as libertarians believe, and so Stossel was saying he was libertarian, and Kennedy was a libertarian, and I wasn't really sure what a libertarian was or believed in. Now, let me just say this right now. Just because somebody says that they're a libertarian doesn't necessarily mean that they, are all in with the Libertarian Party. I personally, I believe in a lot of libertarian values. And what are libertarian values? Libertarian values are, liberty. And if you hear me talk on this podcast many times, I talk about liberty in most things. And, I do focus on medical on this podcast. And it's very important to me that we have medical liberty and free markets. And that's what libertarians believe in, that the government should not intervene in our personal lives. And we will all do a lot better when the government doesn't get involved. So that's libertarian values. But just realize that just because you have libertarian values doesn't necessarily mean that you align with the Libertarian Party. I just said myself, I don't personally, like to associate myself with any one party. I just like to associate myself with liberty and being free. So backing up back to Kennedy. So John Stossel's interviewing her, and he gives away that he is a libertarian along with her, and she believes in free markets. And I'm like, well, I already had a crush on this girl, and then I'm like, wow, and she believes in stuff like this, liberty. Um, so of course, I really like that even more about her. And then I started following more of libertarian principles, which I already kind of was, but I just didn't, know. And I was just, I guess I was learning, that was 20 some years ago. Maybe not quite that long ago. I don't remember the exact time, but so then because Stossel was interviewing Kennedy, I started watching Stossel some more, and he would have a lot of topics on about free market principles. And probably about 15 years ago, John Stossel is going to do an interview. Actually, it's probably about 15 years ago. He's going to do an interview with this guy, this Dr. Keith Smith from the Surgery Center of Oklahoma. And of course, you guys have heard me talk about him on the podcast all the time. He was the first of its kind in the United States, I believe. Well, not really the first of its kind, because many years ago, surgery centers and doctors were free market principles, but it wasn't until the government took over, largely in the 60s and 70s, that doctors and healthcare was no longer a free market. So, but he was going to interview this doctor, Dr. Keith Smith from the Surgery Center of Oklahoma, who had opened a surgery center based on free market principles and wasn't accepting any government type insurance or any insurance at all. It was transparent pricing, no surprise bills. You knew exactly what the price was going to be when you went there, and you paid up front, like you would any other service, right? And this was in the early 2000s. And I'm watching this on Fox News. I'm like, wow, this is cool. Now, how does this relate to me? Well, in 2002, our pharmacy at Moses Lake Professional Pharmacy, we decided we no longer wanted to be in the insurance billing market. We knew it was a racket. We knew it was a ripoff. We knew it was bad for patients. We knew it decreased quality of healthcare, increased price of healthcare, and decreased service. And I wanted to take care of the patient directly. I did not want to be an insurance agent. I wanted to be a pharmacist who could directly educate and empower my patients to take charge of their own health. And so we got out of the insurance market in 2002. Now, I will tell you, there are a lot of people, friends, family, employees, that told us, you guys are crazy. This is 20 years ago. You guys are crazy to do that. You guys won't be in business very long. It's not going to work out. You need to bill insurance and yada, yada, yada. Well, fast forward 20 years, many of my colleagues who owned pharmacies, they had went out of business and pulled their hair out and went bankrupt and went hundreds and hundreds and hundreds of thousands of dollars in debt trying to cash flow the insurance racket that they were in. Whereas here we are 20 years later, our pharmacy is doing wonderful. We love what we do, and we don't have any of that insurance nightmare that we have to do. And it's really helped us thrive too, by not taking it. So and the story goes on. I'm like, okay, so this was 15 years ago that he interviewed Dr. Keith Smith. I watched the interview. It's like, wow, this guy, we're not so crazy. There's somebody else that's maybe crazy as I am, that's opened up a cash only healthcare place. So fast forward, up to about 3 years ago. So in 2018, when I'm writing my book, I'm telling kind of this story to Crystal. She's the one that helped me. She's my chief marketing officer, and she's so helpful in all that I do. But she was also helping me with the book, and I told her the story. And next thing I know, she emails me shortly afterwards and says, "Hey, I got an interview set up with Dr. Keith Smith from the Surgery Center of Oklahoma." And I'm like, oh my goodness. So I got to interview Dr. Smith over the phone, and it was such a pleasure. And since then, I've traveled down to the Surgery Center of Oklahoma. I've toured it. I've met him, had lunch with him. He's just a great doctor, a great guy, and a pioneer in free market medicine. And I just look back at what our pharmacy did 20 years ago and what he did about the same time. And now you look at what's happening in medicine. There's a lot of doctors that are getting out of the insurance racket. They know that it's not good for patients and it's not good for them. If it's not good for them, it's not good for patients. So they're they're in a direct pay type situation, whether they're a family practice doctors, primary care, or they're a specialist. And there's a lot more of those popping up now. So kudos to Dr. Smith for being a pioneer in that area. And he also has what's called the Free Market Medical Association. He and Jay Kimpton, I believe, started this. And it's basically an association where like-minded people in healthcare, whether they're providers of healthcare or payers of healthcare, so employers that are paying a lot of money for health insurance and not getting the benefits that they think they should get. There's these big employers that go to the Free Market Medical Association annual conference, or they're members of it also, but they go to the conference and they network with people and they learn over a couple days, how they can save a lot of money on healthcare. And let me just tell you, people, it's not the government. The government's not going to save healthcare. Government's not going to make healthcare cheaper. They're the ones that made it more expensive. It's individuals choosing free market principles that is going to save healthcare and make it less expensive, better quality, and better service. Don't look for the government to that. So that is coming up in May, in a few weeks, in Texas, and I will be there and networking with a lot of those individuals. And here's what's super exciting and why I talked about Kennedy today. Kennedy will be the guest speaker. And so I'm super excited to, get to see my college crush talk at a free market medical association, and how, for 25, 30 years, I followed her, and it's really actually, changed my career. And so I'm super excited to hear her speak and what she has to talk about when it comes to free market principles in healthcare. It's actually pretty simple. Individuals, it's like any free market principle. Individuals drive the market, drive the price, drive the quality, drive the service. There's no third party in the middle, and that's what really messes up healthcare, is the third party in the middle. So, Kennedy, if you are watching, I'm super excited to get to see you speak. I would love to meet you, and I would love to just like talk to you or interview you for like a few minutes, just to you know, let people know about how free markets can really affect healthcare. So, if anybody knows Kennedy, if anybody has a contact with Kennedy, I would love somebody to reach out to me and let me know, because I would love to interview her for just a few minutes when I see her in Texas in a few weeks. So that's all I've got for today. Um, Kind of a different topic on the podcast, I'm sure, that you guys aren't used to hearing, but it definitely was life changing for me. And it's just interesting how the puzzle just comes together. And I said this many times before, I don't believe in coincidences, and I don't believe when I was watching Kennedy as an MTV VJ 30 years ago, that this is a coincidence that I'm gonna, be at the Free Market Medical Association annual conference where she is at. So, thank you for tuning in. Thanks everybody, and I hope you have a wonderful day.